Hi guys, so as promised I thought I'd do a video for you explaining basically how I went about curing my acne and really problematic skin. That's not to say that every now and again I don't get the odd blemish, but definitely nothing like that I was getting before. I've always sort of suffered with breakouts as a teenager. I used to get quite a lot of spots on my forehead when I used to have a full fringe when I was like 15, 16. And I never had, fantastic, perfect skin. Always had blackheads, quite large pores, and like I say, breakouts quite regularly. But after maybe about 3 years into university, so what I was sort of 22-ish, I started getting quite a few spots on my chin area, and they weren't quite normal spots as in the ones that I usually get. I normally get sort of small red lumps and then they sort of disappear after a day or so, but these were they'd start off, I could feel the bump under my skin, like a lump, like a hard lump underneath my skin. So I knew one was about to come out, and then when it came out, it'd come out with a lovely yellow head which had all like liquid inside, and yellow goo, which would have to be popped. Now I know some people say, oh, you shouldn't squeeze spots, you shouldn't pop them, you shouldn't, get the yellow stuff out, you should just let them go naturally. However, with these type of spots, they would pop themselves if I didn't pop them already. So if I left them to pop on their own, I'd be in a right mess and it'd contaminate the rest of my skin. So I found that the best way would be to actually sterilise a needle and make a small jab to the spot and then squeeze it, which was absolutely gross and quite painful, to be honest with you. And then after that, I would put various spot treatments on top to sterilise the area, I guess, and make sure there was no bacteria left over. And then the wound would close itself eventually, but the spot would actually take at least 5 days to completely clear, and even then I'd be left with almost a scar behind. That scar would eventually disappear within 2 weeks, but nevertheless there was always sort of a red mark where one of the exploding spots had been, as it were. And this would happen, well, it became more regular. So I'd wake up one day and be like, oh, I've got another yellow one, I'd have to get it, pop it, all that grossness. And then that would start to go, and then I get another one pop up, and then some mornings I might wake up and I've got two, and then I started to get them on my cheeks. I've got occasional ones on my forehead. By the end, it was just all over my chin, all over my cheeks. Definitely not the worst acne I've ever seen. I've seen a lot worse off people on YouTube and on blogs and whatnot, but it doesn't matter if anybody else's is worse. If you feel that yours is, it's really getting you down and it's really difficult to deal with and you don't like it, then that's a big enough issue, isn't it? So generally I just kept going back to the doctors and saying, my skin, it's really bad, it's making me really upset, I'm really self-conscious about it. I'm always having to apply foundation before I leave the house. So I'd really stress my concern to the doctor and tell him, how it was making me feel. And he would listen, and he'd prescribe me some acne drugs, and I'd take these, and to be honest, I didn't see an improvement in my skin, and if anything, the acne just got worse and worse, and this was going on, for a fair few months, probably up to a year even, I'd say. And in which time I just was getting more and more depressed about the situation, because I was spending so much on makeup, really high-end makeup, Benefit, concealers, MAC, just absolutely loads to cover them up. And whilst I did a fantastic job at covering my skin, because people would say, oh, it doesn't look that bad, I'd just take it off at night and honestly I'd just look awful. I wouldn't dare leave the house without any makeup on. That would just be, without question. So I was starting to like feel really down about it, and not only that, it was itching, my face was sore, it was just an absolute nightmare. So in the end, after all the drugs, I think I went on 2 types of antibiotics from the doctors and they didn't touch it and they didn't work. I went back again and I just said, look, I'm really unhappy. Everything I seem to be trying is just failing and it's just getting worse and worse, and I'm just worried one day I'm going to wake up and just not even be able to see my face through spots. So in the end, I went back to the doctors and he said, basically, we've tried all the antibiotics and your skin is not really reacting to it. He said that he felt that I had some form of cystic acne, which meant, basically, I think it means something along the lines that the problem is within the inside. So no matter what I did to my face, no matter what products I used, it wouldn't actually help the situation because the spots were coming from within, which in most cases I think that's generally the way acne goes. People always assume that acne and spots are because people don't wash their faces properly and, you know, they're dirty, but it's nothing to do with that. In fact, you're probably cleaner than most people because you're over cleaning trying to get rid of the spots. So he said that he'd basically need to refer me to a specialised dermatology unit at a local hospital of mine, and I just thought, oh yeah, great, we're getting somewhere, you know, this is going to be good. So I went along to the hospital, a specialised clinic that deals with skin problems, and you know, they took a look at my skin and they said, yeah, I can see why you're unhappy. I said, you know, it's amazing that I've come here today without makeup on because, you know, driving here I was so self-conscious because I never leave the house without makeup, but obviously because the appointment was to look at my skin, I needed to have a face without makeup. So, but actually what I did is, it was that bad that I put my makeup in my bag, so once I'd seen the consultant I could then apply it in the toilets and then leave the hospital feeling a little bit more normal. So you know, that just shows how desperate I actually was. One of the options that the dermatologist told me about was an antibiotic that was along the lines of some of the antibiotics I'd been trying at the doctor's, and he said that it may work, but it's possible that because the others hadn't worked, then this wouldn't. And I thought, well, why do I want to try something that's probably not going to work? I'd rather, you know, not waste my time. So the second option was a bit of a stronger drug, which had quite a few side effects that I was told about, which I have the side effects here for you. But of course, the drug that I'm talking about is what this video is about, and it's called Roaccutane, also known as isotretinoin. I think that's how you say it. I will put the name anyway in the description box for you in case you're interested. Like I say, this is a referral drug only, so you do need to go through your doctors to get referred to go onto this medication. But obviously I did that, and then hence I got put on this medication. Now there's quite a few things to consider. Basically, I'll just talk through quickly the main side effects. This says very common side effects. More than 1 in 10 people are likely to get these. So abnormal laboratory tests results, back pain, blood problems, dermatitis, dry skin. It says you should use a moisturising cream while you are taking Roaccutane. Eye or eyesight problems such as blurred vision, changes in colour vision, decreased night vision, oversensitivity to or fear of light, eye irritation, dry eyes, etc. Fragile skin, inflammation of the eyelid, inflammation and cracking of the skin of the lips or dry lips, itching, joint pain, muscle pain or tenderness, skin exfoliation, skin rashes or rashes. Obviously, because they are very popular side effects, this drug is not one that they give to people lightly. They only give it to people in like quite extreme cases, because generally the side effects are quite prominent, really. They're likely to happen. Another main side effect to Roaccutane is that it can actually cause liver damage, which obviously is quite serious. So again, they don't prescribe it very lightly. This just means that every couple of months you have to have a blood test to check your liver's functioning properly. Also, they are very clear that pregnancy is a no-go on this medication, and you have to ensure that you are using contraception and provide evidence that you are if you are taking this drug. So for instance, if you have a partner and you are not on either the pill or the injection or the implant, then you will not be able to take this medication. You have to go on to that form of contraception before you're allowed to take it, because if by any chance you get pregnant whilst taking this medication, then it can cause really serious side effects to your unborn child, real bad deformities and things. So it's really serious, the pregnancy side of things. And because of that, every month, no matter who you are, it doesn't matter if you're in a relationship or not, you have to go and get a urine sample to check that you are not pregnant before getting your medication. So every month I would have to go to a hospital, have a urine sample, well, have a urine test rather, and then prove I wasn't pregnant in order to collect my prescription for that month. So it was really like quite serious. And whoever you are, like I say, even they told me that even 13-year-olds that are on this drug that are not even sexually active still have to provide that urine test sample, because that's just their regulations on it, and you have to sign a proper declaration saying you understand this procedure. So that was like really serious. I thought, wow, that must be you know, there must be a real reason for that. But that never provided me with any problems. It just meant it was quite inconvenient having to go every month to go and get a test done to then get my medication. But in the long run, definitely worth it. Do it again 100 times over. The only side effects I experienced, and I just thought, oh my gosh, I'm going to get all the side effects that it talked about. The first thing to go, within the first 2 weeks, I'd say even less, of taking the medication, my lips went extremely dry. Now, I've never been anyone to suffer with dry lips, but in this particular occasion they just went dry straight away. They never cracked and they were never painful, but I would always have to apply a lip balm like every 10 minutes. Like, it was that dry. But that wasn't really an issue. I just made sure I found some really good lip products like Carmex. I found that to be one of the top things, and I just kept applying that, and generally that was the only side effect. My skin as well, I've always been an oily skinned person. That went a lot drier, but I absolutely loved that because I just put a good moisturiser on, and I didn't have greasy skin for once in my life, and that was amazing. So I actually loved that side effect. And then the other side effect slightly that I got was my hair also got quite dry. However, I've always had quite easily greasy hair, so I'd wash my hair and the next day it'd be quite greasy again at the roots. But this drug meant that my hair was quite dry and didn't need washing for up to 5 days. So that was amazing for me because I didn't have to wash my hair as often. It was just amazing. But again, that's only a side effect whilst you're taking the medication, and as soon as I stopped taking it, my hair returned to normal. So I got given, I can't remember how many milligrams I got given, but basically they give you a starting dose based against your weight. And I'm quite a small person. I lost quite a bit of weight on Weight Watchers, blah blah blah. If you've read my blog or stayed with me quite a while on YouTube, you'll know that I did lose quite a lot of weight. I went on a diet and it worked, and so my weight was quite low. I think I was around 8 stone at the time of starting Roaccutane, so I got quite a small milligram dosage because they go against your body weight, sort of percentage against your body weight or something. So the first month I started taking the drug, really optimistic, and I saw, other than my dry lips and my easy to wash hair, I saw no improvement in my skin at all. And I thought, wow, something as well that I forgot to mention is it's not recommended that you drink any alcohol whilst taking Roaccutane or isotretinoin. So which wasn't a massive problem to me. I enjoy a drink when I go out with my friends, and I go to clubs and whatnot, but it is advisable that you don't drink whilst taking the medication. Apparently you can maybe have an odd glass of wine or something if you really must, but apparently it can make you quite poorly if you do mix the medication with alcohol. So I didn't risk it for the whole time I was on the drug, and I just didn't drink any alcohol, which sometimes it's a bit rubbish because I had to endure my birthday and Christmas without any alcohol, so I couldn't even have a little celebratory drink. But like I say, it's not really advisable, so I wouldn't really recommend you drink any alcohol on the drug. So anyway, the first month, like I say, noticed no change to my skin. In fact, I'd say it probably even got worse at times. So I went back to the hospital and I was like, I don't think it's working. And they said, yeah, we would have expected to see a bit of improvement by now, so I think we need to up your dosage. So they upped my dosage. After that month, I didn't see that much change. So on the third month, they upped my dosage again. And then that was when it really started to kick in, and I just thought, wow, my skin is getting really good now. And in total, I was on the medication for 6 months, and by the end of the 6 months, I'm not kidding, my skin was alike to a baby's skin. It was just fantastic. I didn't have to wear foundation or concealer. I just completely just never needed to go into my concealer drawer. So after 6 months, I finally got my skin to actually the stage that I wanted it to be at, and to be honest, the results were a lot better than I could ever have wished for. I was really worried about coming off the medication though. I just thought, oh, within a month my spots are going to come back and I'm going to have really awful skin again, and I got so used to having really good skin, so I was really worried about coming off them. But I think there's a percentage in like something like 1 in 20 people, I might be making this up so I'll check, but 1 in 20 people or something redevelop their acne and they have to go back on the medication. But I just thought, well, it's quite reassuring to know that if it did come back, I could actually go back on the medication. But touch wood, I've got wood here, that's ideal. I came off the medication in February and it is now August, so February, March, April, May, June, July, August. So I've gone 6 months without the medication and my skin has been pretty damn good. I get the occasional like small red spots, as you would. I've got like the tiniest one here on my chin, but generally nothing like I was getting before. Like literally they were just humongous and awful and gross, and I never want to experience anything like that again. I've also been quite lucky in the fact that none of them have scarred my face. None of them's done any lasting damage. The doctor did say if my skin carried on breaking out as it was for a longer period of time, then I perhaps would have been left with permanent scarring to my skin, which obviously that would have, you know, been awful. So I'm so glad that I actually went to the doctors and did something about it at the time, rather than just hoping it'd get better on its own. So all in all, I would say if you have got what you consider to be bad enough acne, like if it's getting you down, if you're constantly having to put like 10 layers of concealer on your skin just to leave the house, it's really sore, it's itchy, then it's likely that it's not going to go away on its own no matter what products you use. So I definitely say, you know, go to your doctors, try the antibiotics first because they might work for you, but if not, get referred for a stronger medication like Roaccutane. I read various articles about the drug before I started it, and some of them really did worry me because some people had horrendous side effects with the drug. But I am obviously one of the people that have got on really well with the medication, and it's literally the best thing that I've ever done, because like I say, that acne that I was getting was seriously getting me down to the point of being depressed about it, and I don't think anyone should feel that way about the way they look. So if you're really struggling with your skin, then I really would recommend you finding out from your doctor about possibly going on Roaccutane. Like I say, it is quite a strong drug and it has its side effects and potential dangers and whatnot, but actually for me it's just been the best thing that I ever did, and now I have quite normal nice skin, I'd say. At the minute I'm not wearing any foundation, I'm just wearing I can't even think what I'm wearing. What am I wearing? Not BB cream. Moisturiser, tinted moisturiser, that's what I'm looking for. Couldn't think then what I was wearing, but yeah, tinted moisturiser with a bit of powder on top. I'm aware that my camera isn't the greatest, so even when I was filming videos and telling people that I had really bad skin, they couldn't see on camera. So I don't think that will make matters any better for you to see what my skin's like now, because my camera's just not good enough. But let me tell you, my skin is just like 1,000 times better than it was before. As a side note, if I do get a little red spot every now and again, one of the best things that I find to apply at night time and just let it soak in whilst you're sleeping is Sudocreme or Sudocreme, or however you like to say it. People think that this is for babies' bottoms, which it is actually, because it says nappy rash, but underneath in small writing it also says acne, and this works really well in taking the redness out of spots. And usually say I've got my little red spot there, if I put a bit of this on at night time, in the morning I'll wake up and it'll be considerably reduced and almost gone. So I find this stuff really useful just for like normal everyday little pimple spot thing that you get. But in terms of, you know, the ones that's really big and yellow and gross, you need to get that sorted either, you know, by medication from your doctor or being referred to special dermatologists, because in my opinion no product that I used ever could have cleared up the mess that my face was in. So anyway, I hope that you find this helpful. If you do have any questions about the medication or anything about skin problems and, you know, general any questions, then please feel free to comment or tweet me at Ellie1989. I will always get back to everyone, and thank you for watching this video, and I'll see you guys soon. Bye.